Hi, I'm Wendel. Today I'm going to be going through some steps with you so that you can learn how to do the kettlebell swing. We're just going to be covering the basics of this, not so that you can instruct it, but just as therapists, I think that we should be aware of what our patients are doing and our clients are doing. And lots of our patients and clients are using kettlebells in their workouts these days. This video will just give you a better understanding of what they're talking about when they say that they're doing a kettlebell swing. And it'll help you to understand the basic mechanics. So when we first come up to the kettlebell, it's called addressing the bell. So we're going to come up to the kettlebell and stand a few feet behind it. Some things that are important to remember in the swing are that you want to keep your spine in alignment the whole time. So you're not rounding forward or bending. A good way to remind your clients of what to do with this is to have them practice a hip hinge technique. So that they can just picture having something like the PVC pipe along their back and hinging forward, keeping everything in alignment. So you might have them just practice this a few times, just to get the idea. Another cue that I give them is to imagine if I'm going to come up in front of them and karate chop their hips right at the hip crease, sending their hips and their buttocks back. Because most patients are used to doing squats, their initial reaction to this exercise will be to try to squat down to do it, and we don't want that. So remember to cue them to hinge at the hips and to keep the spine in alignment. The knees are going to bend just slightly and open out just a little bit as the kettlebell comes back. When we're picking up and swinging the bell, we don't want to use our arms. The purpose of this exercise is to use the strength from your hips and your glutes and develop the posterior chain. So another common mistake for patients is to be using their arms to try to lift the bell rather than using the force of their hips to drive the bell up. So we want to cue them to have their shoulders back and down and to squeeze the arms into the body nice and tight. Another thing to consider with this is the breathing. Clients often hold their breath when they're doing exercises. With this exercise, you inhale as you're bringing the bell back and you're doing a hike pass of the bell back between your legs. And you exhale as you come up and lift the bell. So I'm going to show you what this all looks like. We come up to the bell, we grab it with both hands and tilt it back just slightly. Then we're going to do a hike pass and then we're going to stand up. And then we park the bell back in front of us. So there you have it. That's the basic mechanics of the kettlebell swing. Thank you.